If you're over 65 and your blood pressure just won't come down, no matter how many pills you take, I need you to watch this video until the very end. Because what I'm about to share with you today is something most people over 65 have never been told. And it could change your mornings and your numbers starting tomorrow. I'm Lucy Morgan, Senior Health and Wellness Researcher. And in the past few years, I've spent hundreds of hours going through published medical studies, clinical trials, and real senior experiences, all focused on one question. Is there a natural, safe way for seniors to support healthy blood pressure without adding another pill to their routine? And the answer I found surprised even me. Let me ask you something personal. Do you check your blood pressure and feel that quiet fear when the numbers are too high? Do you lie awake at night wondering what those numbers are silently doing to your heart? Your brain? Your kidneys? Do you feel frustrated because you're doing everything right, taking your medication, watching your diet, and the numbers still won't budge? If that sounds like you are not alone. And more importantly, it is not your fault. Here is what nobody explains properly after 65. As we age, our blood vessels go through a natural process called arterial stiffening. Think of your blood vessels like a garden hose. When you were young, soft, flexible, elastic, blood flowed easily. Your heart barely had to work. But after decades, that hose stiffens, hardens, and now your heart has to push much harder just to move blood through your body. That extra force? That's what shows up as high blood pressure on your reading. On top of that, after 65, your kidneys become less efficient at removing sodium. Sodium holds water. More water means more pressure against your vessel walls. And here is what frustrates me most about how this is handled. Most blood pressure medications slow your heart down, or force your kidneys to flush water, or block certain hormones. They treat the symptom. They don't fix the root cause. That is why so many seniors take pills for years, and their blood pressure is still not where it should be. But nature, as always, already has the answer. 1 glass, every morning, of this red drink, beetroot juice. I know exactly what you're thinking. Beetroot, that's it. Stay with me, because the science behind this is not folk medicine. It is published, peer-reviewed research, and it is remarkable. Beetroot is one of the richest natural sources of dietary nitrates on the planet. When you drink beetroot juice, your body converts those nitrates into something called nitric oxide. And nitric oxide does something incredible. It signals the smooth muscle cells inside your blood vessel walls to relax, to open up, to widen. Suddenly, blood flows more freely. Your heart doesn't have to work as hard. And that pressure, the number on your reading, begins to drop. Naturally, safely, without a single extra pill. Research published in peer-reviewed journals has shown that dietary nitrates from beetroot juice can lower systolic blood pressure, that's the top number, by 4 to 10 points. And for seniors over 65, dropping systolic pressure by even 5 points reduces stroke risk by 14% and heart disease risk by 9%. Those are not small numbers. Those are life-changing numbers. And seniors all across the United States are experiencing this firsthand. In online health communities and senior wellness groups, the same story keeps coming up again and again. I started beetroot juice every morning. After 1 week, my numbers were the lowest they've been in years. My doctor asked me what I changed. I told him. He said, keep doing it. I was skeptical. I tried it for 7 days. I couldn't believe what I saw on that monitor. These are real people, real seniors, who simply decided to try 1 glass every morning. So let me tell you exactly how to do this, the right way, for the best results. Every morning, within 30 minutes of waking up, drink 1 glass of pure beetroot juice, approximately 250 milliliters, 1 cup. Morning timing matters. Blood pressure naturally rises in the early hours as your body prepares for the day. This is when most cardiac events occur in seniors. Drinking beetroot juice first thing means nitric oxide production starts exactly when your body needs it most. For choosing your juice, 2 options. Option 1. Store-bought pure beetroot juice. Check the label. Pure beetroot. No added sugar. No added salt. The simpler the ingredients, the better. Option 2. Fresh. Blend 1 medium beetroot with half a glass of cold water. Strain and drink immediately. Fresh has higher nitrate content, but store-bought works beautifully for daily convenience. Now, 5 ways to make this even more powerful. 1. Add fresh ginger. A small thumb-sized piece. Ginger has natural anti-inflammatory properties that work alongside nitrates to support blood vessel health. The combination is significantly more effective than either alone. 2. Add half a lemon. Vitamin C and bioflavonoids support healthy vessel function. And honestly, it makes the juice taste much better, which means you'll actually stick with it every morning. 3. Reduce sodium slightly. Not eliminate it, just reduce. Cut half a teaspoon of salt per day. Choose lower sodium options where you can. Combined with beetroot juice, this creates a powerful effect on your readings. 4. Take a gentle 10-minute walk after drinking your juice. Morning movement helps your body use the nitric oxide your juice is producing. Slow and gentle is perfectly enough. 5. Be consistent for at least 7 days before you judge the results. Some seniors notice changes within 48 hours, others need a full week. Your body needs time to build up nitric oxide production. Commit to 7 days, then check your numbers. Now, something very important. If you are currently taking blood pressure medication prescribed by your doctor, please continue taking it. Do not stop or change your medication without speaking to your doctor first. Beetroot juice works alongside your current treatment, not instead of it without medical supervision. What I encourage you to do, start your morning beetroot juice today. After 7 days, take your readings to your doctor. Show them the numbers. Have that conversation. Many seniors have been able to work with their doctors to adjust their treatment after seeing natural improvements. But always, do this with your doctor's knowledge. High blood pressure is called the silent killer for a reason. No symptoms, no warning, until something goes wrong. A stroke, a heart attack, kidney damage, vision loss. These don't announce themselves. They arrive without warning, and they change everything in a single moment. But you are watching this video right now, which means you are someone who takes their health seriously. Someone who wants to do everything possible to protect themselves and the people who love them. 1 glass, tomorrow morning, before breakfast. That is all it takes to start. Give it 7 days, check your numbers, and then come down to the comments and tell me what happened. I read every single comment, and I would genuinely love to hear your story. If this video helped you today, please hit subscribe right now. Every week, I share natural, research-backed health information specifically for seniors over 65. It is completely free, and it could genuinely protect your health for years to come. And if you know someone over 65 who is struggling with blood pressure, a friend, a spouse, a neighbor, please share this video with them today. Sometimes the most powerful thing we can do for the people we love is simply pass along the right information at the right time. I'm Lucy Morgan. Thank you so much for watching. Take care of yourself, and I'll see you in the next video.